AI agents for addressing Harvard Health Systems Innovation Labs selected health systems challenges. Healthcare systems globally face persistent, cross-cutting challenges that limit efficiency, continuity, and equity of care. From fragmented records and communication barriers to staff shortages and data overload, these issues threaten patient outcomes and clinician well-being. Intelligent, autonomous, and adaptive healthcare AI agents, equipped with components like cognition, perception, memory, world models, reward systems, emotion modeling, and action systems, offer transformative potential to overcome these systemic obstacles. The following narrative outlines how 7 types of healthcare AI agents can be strategically deployed to address each of the Harvard Health Systems Innovation Lab's priority challenges. 1. Electronic health record, EHR, analysis. While EHRs have digitized and centralized patient data, the sheer volume and complexity of these records make them difficult to analyze manually. There's a growing need for intelligent systems that can automatically extract insights from EHRs, such as disease patterns, risk factors, and potential outcomes, to support early diagnosis, clinical decision-making, and personalized care. AI agents such as React AI agents and memory-enhanced AI agents can analyze large volumes of structured and unstructured EHR data to extract clinically relevant patterns and risks. These agents use cognition and perception to interpret labs, imaging, and notes, while their world models simulate disease trajectories for predictive care. Memory components retain longitudinal patient histories, enabling continuity across visits. By automating triage alerts, treatment summaries, and evidence-based recommendations, enhanced with RAG, retrieval augmented generation, these agents significantly reduce clinician burden while enhancing precision in decision-making. 2. Diagnosis and monitoring improvements. AI and machine learning are transforming traditional diagnostic methods by detecting patterns in clinical, imaging, and physiological data with greater accuracy and speed. These tools can power early interventions and continuous remote monitoring through wearables and mobile devices, ensuring timely and personalized treatment adjustments, especially for chronic and high-risk patients. Self-learning AI agents and tool-enhanced AI agents enhance diagnosis and condition monitoring through real-time analysis of multimodal data from wearables, sensors, and labs. These agents learn from ongoing interactions and clinical outcomes, refining their predictive models to detect subtle changes and recommend timely interventions. Their perception systems continuously monitor physiological signals, while emotion modeling ensures communication, and alerts are patient-sensitive. Their action systems help automate interventions and escalation workflows, improving responsiveness and personalization in chronic disease management. 3. Intelligent support. Chatbots. AI-driven chatbots, powered by large language models, LLMs, can provide 24/7 support to patients and healthcare professionals. They can answer questions, triage symptoms, guide patients to appropriate services, and support clinical workflows, reducing burden on staff while enhancing patient engagement and health literacy. LLM-enhanced AI agents and emotionally aware React agents serve as intelligent conversational assistants, available 24/7 to patients and providers. These agents leverage large language models for natural dialogue, symptom triage, and protocol guidance, while their memory systems personalize interactions based on user history. Emotion modeling enables empathic tone modulation, building user trust. These agents streamline administrative workflows and improve patient engagement, particularly for underserved populations or after-hours support. 4. Fragmentation of care. Disparate EHR systems and siloed health services often result in poor coordination across providers, settings, and specialties. AI can be used to build interoperable models that learn and adapt across different systems, enabling seamless care transitions and continuity, particularly between primary and mental health care. Tool-enhanced and self-reflecting AI agents bridge these divides by accessing siloed systems through APIs and adapting through federated learning. Their memory and world models ensure continuity despite inconsistent infrastructure, while self-reflection mechanisms analyze gaps in care transitions and refine coordination strategies. These agents proactively schedule follow-ups, reconcile medications, and ensure that care plans remain aligned across services. 5. Too much information. The explosion of digital health tools has created an overwhelming number of options for users. Many lack clinical validation. AI-based recommender systems could help filter and match users with evidence-based apps and services based on their health profiles, preferences, and behavioral data, promoting safer and more effective self-care. In a landscape flooded with digital health apps, LLM-enhanced agents and React plus RAG agents serve as intelligent curators. They use semantic understanding and user profiling to recommend validated tools tailored to individual needs. These agents parse user behavior, clinical history, and engagement data, applying world models to predict effectiveness. By integrating reward systems and emotion modeling, they refine recommendations based on satisfaction, literacy, and preferences, reducing overwhelm and guiding users to trusted digital therapeutics. 6. Shortage of healthcare workers. Staff shortages are exacerbating care delays and clinician burnout. AI can help fill gaps by automating administrative tasks, providing decision support, extending telehealth capabilities, and even assisting with diagnostics and triage, ultimately enhancing provider efficiency and expanding reach, especially in underserved areas. To alleviate clinician shortages, tool-enhanced, LLM-enhanced, and self-learning agents act as digital team members. They automate routine documentation, provide real-time decision support, and conduct remote assessments. Perception and cognition layers help balance workload, while reward systems optimize productivity-enhancing behaviors. These agents also serve as intelligent tutors, supporting continuous professional development. By reducing administrative overhead and scaling expert capacity, they help mitigate burnout and improve care accessibility. 7. Fragmented care pathways. Disjointed care pathways compromise outcomes due to poor handoffs, redundant testing, and mismatched treatment plans. AI-powered orchestration platforms can track patients longitudinally, flag care gaps, coordinate referrals, and harmonize communication between multidisciplinary teams, ensuring more coherent and continuous care. React and self-reflecting agents function as orchestration engines that simulate care sequences and monitor for breakdowns. With persistent memory, predictive simulations, and automated task execution, they proactively manage patient journeys, surface uncoordinated actions, and facilitate shared decision-making. These agents enable systems-level optimization while adapting care navigation to individual patient contexts. 8. Health literacy. Low health literacy hinders patients from understanding their conditions and following treatment plans. AI can translate complex medical language into accessible, culturally sensitive content, tailored to individual literacy levels. It can also provide interactive education and myth-busting tools to empower informed health choices. LLM-enhanced agents and emotion-sensitive chatbots translate complex medical content into readable, culturally appropriate information. With tailored delivery based on literacy levels and emotional state, these agents provide personalized microlearning, clarify diagnoses, and debunk misinformation. Through reward systems, they reinforce comprehension-building behaviors, empowering individuals to take an active role in their health. 9. Preventive health engagement. AI enables a shift from reactive to proactive care by assessing individual risk factors and predicting potential conditions. Preventive platforms can deliver timely lifestyle advice, reminders, and interventions through apps and wearables. Machine learning can optimize these interventions based on real-time feedback and health trajectories. Self-learning and tool-enhanced agents drive a shift toward proactive care by continuously analyzing real-time data from wearables, lifestyle logs, and environmental sensors. These agents use world models to predict disease risk, action systems to initiate nudges or screening schedules, and emotion modeling to maintain engagement. Over time, they adapt interventions to user behavior and risk profiles, encouraging consistent adherence to preventive health practices. 10. Breaking communication barriers. AI can serve as a real-time translator, both linguistically and conceptually, making medical information understandable and inclusive. From simplifying lab reports to offering multilingual chatbot support, AI tools enhance communication between patients and providers, bridging cultural, cognitive, and educational divides. LLM-enhanced and environment-controlling AI agents enhance health communication by translating medical information into layperson language and multiple languages. These agents use natural language understanding and emotion modeling to personalize delivery, identify confusion, and adjust tone in real time. For instance, they may explain lab results, summarize treatment options, or guide users through consent forms, enhancing understanding and inclusivity in clinical communication. 11. AI in pediatrics. Pediatric healthcare is uniquely complex due to children's ongoing development, fragmented data sources, and privacy constraints. AI solutions must integrate inputs from caregivers, schools, and providers while adapting to changing developmental stages. Tailored models can help manage rare diseases, growth monitoring, and behavioral health more effectively. Memory-enhanced, React, and self-learning agents help unify data from caregivers, schools, and clinicians, tailoring insights to each child's age. These agents monitor for neurodevelopmental or behavioral risks, adapt recommendations across time, and integrate emotion-aware interactions for family-centered care. Their action systems help coordinate appointments, interventions, and follow-ups across diverse pediatric care ecosystems. Conclusion: healthcare AI agents are poised to revolutionize the way we address the most entrenched challenges in health systems. By combining advanced components, such as perception, cognition, memory, world modeling, reward optimization, and emotion modeling, these agents enable personalized, predictive, and proactive healthcare. From analyzing complex EHRs and improving diagnostics to closing care gaps and enhancing preventive engagement, AI agents represent the next frontier in intelligent, system-aware healthcare transformation. By integrating these agentic systems thoughtfully, we can reimagine care delivery that is not only more efficient but fundamentally more human-centered.